Good day, my name is Christine De La Cruz, your nurse student for today from Dr. Yang's Colleges Incorporated. Now, I will perform obtaining urine specimen using clean midstream cartridge for urinalysis and culture. The goal of this performance is an adequate amount of urine is obtained from the patient without contamination. Now, the first procedure is bring necessary equipment to the bedside stand or overbed table. Bringing everything to the bedside conserves time and energy. Arranging items nearby is convenient, saves time, and avoid unnecessary stretching and twisting of muscle to the part of the nurse. Organization facilitates performance of tasks. So we have the basin, the alcohol, the wet cotton balls, the urine specimen container, the biohazard bag or sealable plastic biohazard bag, and the pairs of non-sterile gloves. Next, perform hand hygiene and put on PPE if indicated. Hand hygiene and PPE is to prevent the transmission of microorganisms. PPE is required based on the transmission precaution. Next, identify the patient, explain the procedure to the patient, and if the patient can perform the task without assistant after instruction, leave the container at bedside with instruction to call the nurse as soon as specimen is produced. Identifying the patient to ensures that the right patient receive the interventions and helps prevent errors. Explanation, provide reassurance and promote cooperations. So, good day ma'am. I'm your nurse for today. I'm Christine De La Cruz, and I will be your nurse at 6 a.m. in the morning until 6 p.m. in the evening. So, may I know your name ma'am? And your birthday?
December 1, 2010.
So, may I have also your identification band? So, you are Miss Daniela De La Cruz and your birthday is December 1, 2010. So, ma'am, this morning, Dr. Dalaga made his round and he has ordered a urine specimen collection for you. So, today I will instructing you on how you are going to collect your urine specimen from this container using a clean midstream patch technique. And after you collect your urine, you are going to send it to the laboratory for urinalysis and culture and sensitivity. This test will determine what specific microorganism might cause your urinary infection. And after the result has released, I will be relying to Dr. Dalagan, and he will determine of what specific or appropriate treatment will be recommended for you. So, do you have any concern or question, ma'am? Okay. Next, have the patient perform hand hygiene if performing self-collection. Hand hygiene prevents transmission of microorganisms. So, ma'am, I'm asking you if you want me to assist you for your collection of urine specimen. Okay, but before I'm instructing you, you need to wash your hands first. Next, check the specimen label with the patient identification bracelet. The label should include the patient name, identification number, time specimen was collected, route of collection, identification of the person obtaining sample, and any other information required by agency policy. Confirmation of patient identification information ensures that the specimen is labeled correctly for the right patient. So the label should include the patient name, Miss De La Cruz, Daniela, and the identification number 103506. Then the time and date of specimen was collected, March 29, 2021, 6:30 a.m. Route of collection, clean midstream patch. Next, close the curtain around the bed and the door to the room if possible. Closing the door and curtains provide patient privacy. Next, put on unsterile gloves and assist the patient to the bathroom or onto the bedside commode or bedpan. Then instruct the patient not to defecate or discard the toilet paper into the urine. Gloves prevent transmission of microorganisms. Then stool or toilet paper may contaminate the specimen. So, ma'am, I will assisting you to the bathroom and make sure that you are not to defecate or discard the toilet paper or any materials to the urine specimen. So, the urine will not be contaminated. So, let's go, ma'am. Before collecting a urine specimen into this container, you have to instruct the patient to perform a perineal care first. For the female patient, instruct the patient to separate the labia for cleaning the area and during the collection of urine. Then, cleaning the perineal or penis reduces the risk for contamination of the specimen. So, first, ma'am, you have to separate your labia or clean the area for the collection of the urine using your 2 fingers. Then, you are going to use a cotton balls moistened to clean each side of the urinary meatus from front to back or using the 7th stroke to perineum from the anus. Then the lateral side first. And you are going to use each cotton balls for each side. Then another cotton balls for the middle part. Next, for the male patient, Male patient should use a towel to clean the tip of the penis and wiping in a circular motion away from the urethra. Instruct the uncircumcised male patient to retract the foreskin before cleaning and during collection. Cleaning the perineal area or penis reduces the risk for contamination of the specimen. So, sir, you should use a towelette or cotton balls moistened to cleanse the tip of the penis by wiping in a circular motion away from the urethra. And you are also clean the penile sharp using the cotton balls moistened for each single stroke. So, first is wiping the tip of the penis in a circular motion away from the urethra. Use another cotton balls. For the penile sharp, the ventral side first. The lateral side. The other side. The dorsal side, and the scrotum. Next, have the patient to void a small amount of urine into the toilet, bedpan, or commode. The patient should then stop urinating briefly, then void into the collection container. Collection specimen 10 to 20 ml is sufficient. And then finish voiding. Do not touch the inside of the container or the lid. Collecting a midstream specimen ensures that the fresh urine is analyzed. Some urine may have collected in the urethra from the last void. By voiding a little before collected the specimen will contain only fresh urine. So, sir, you are going to void a small amount of urine. Then let your urine stream on the first urine flow to continue it flowing. To wash the urethra, and you need to stop briefly and voiding into the collection on the container. Then, you're going to collect a urine specimen with 10 to 20 ml. Then, after you collect the adequate amount of urine, you continue your urination to the bowl or commode. So, for the female patient, ma'am, you are going to void a small amount of urine and let your urine stream on the first urine flow to continue it flowing. Then, you need to stop briefly and voiding into the collection container, and you are going to collect urine specimen with 10 to 20 ml. After you collect the adequate amount of urine, you continue your urination to the toilet or commode. So, do not contaminate the inside of the container when voiding. Next, assist the patient from the bathroom, of the commode, or of the bedpan. Provide perineal care if necessary. Perineal care promotes patient comfort and hygiene. Next, for the male patient. Next, remove the gloves and perform hand hygiene. Removing gloves properly reduces the risk for infection, transmission, and contamination of other items. Hand hygiene reduces the transmission of microorganisms. Next, place label on the container for facility policy. Place the container in plastic, sealable biohazard bag. Proper labeling ensures accurate reporting of result. Packaging specimen in a biohazard bag prevent the person transporting the container from coming in contact with the urine. So the label should place to the body of the container and not to the lid of the container. Remove other PPE use and perform hand hygiene. Removing PPE properly reduces the risk for infection, transmission, and contamination of other items. Hand hygiene reduces the transmission of microorganisms. Next, transport the specimen to the laboratory as soon as possible. If unable to take the specimen to the laboratory immediately, refrigerate it. If not refrigerated immediately, urine may act as a culture medium, allowing the bacteria to multiply and skewing the result of test